Hi everyone, myself Dr. Shashidharan, a consultant pediatrician. So today I'm going to discuss with you about on acute gastroenteritis in children. So as the name is mentioned, it is an acute process. Very acute gastroenteritis, it means that it is causing some kind of discomfort to the gut. Okay, so gastroenteritis in children. So the major, more common presentation of gastroenteritis in children are the child will start having diarrhea, which is a rice watery kind of stool. The child is pausing around 3 to 4 episodes of loose stools per day, very watery in consistency, and child may also have some kind of abdominal pain, discomfort associated with nausea, or some children may have vomiting also. So this can be due to many causes. The major common in smaller children are the gastroenteritis can be due to formula or faulty feeding. So improper faulty feeding dilution and techniques. In a bigger children, it can be due to contaminated food, contaminated vessels, and contaminated outside food eating. This all can provoke to acute gastroenteritis in children. In some condition, can be due to parasitic infection. So, but what all the organism that is leading to the gastroenteritis? The more commonly viral infections are the major cause behind the acute gastroenteritis in the children, followed by with some bacteria. They do also cause bacterial gastroenteritis, and then parasitic infestation, as I told you already. So what I want to do, sir, for my kid, if my child is having more than 3 to 4 episodes of loose stools per day, abdominal pain, child is crying, has a low grade fever, so how do I proceed? So many of you have a wrong notion that when the child is passing too much of loose stool, so if we stop giving the water, the child will stop passing the loose stool. This is a myth and wrong notion that I want to state you very strongly, that it doesn't mean that passing more stool you should stop giving the fluids. That is a wrong way. The first line of management in treating acute gastroenteritis is that you have to rehydrate the patient. So as much as the stool and water losing in the latrine or stool, you should be able to replace with the oral fluid. So that comes under the major treatment plan in acute gastroenteritis in children with no dehydration, where we prefer the WHO ORS, which has a very good osmolality. So for your kid, you should start giving WHO ORS, 1 sachet of ORS in 1 liter water mix, and start giving to your kids based on their weight. Example, if your kid is weights around 10 kg, you can give 10 ml per kg of water intermittently throughout the day. Like if I have a 10 kg child, I can give around 100 ml water intermittently every 30 minutes, 1 hour. Per day, you can give around 1 liter of WHO ORS to mix in a water preparation and give, so that the patient will get rehydrated. That is a very most important thing. And don't prefer this kind of ORSL kind of drink. I suggest you to prefer only WHO ORS, which is a very good rehydration solution. It is the biggest invention in the scientific society. Then followed by which, your child gut is very fragile. So to replenish the gut mucosa, we are suggesting you to give syrup zinc gluconate or acetate, which comes in 5 ml 20 milligram, which we can give around 5 ml for your bigger kids for a duration of 14 days. It will improve the gut mucosal barrier, so it will easily, the child will get improved faster. And if your child is having any fever, anything, you can give SOS paracetamol. When needed, you can give paracetamol. And if associated vomiting or anything is there, you can go for syrup emicet or ondansetron. That is also, you can go for it. So I expect you to give or rehydrate your patient or your kid adequately during the course of this acute gastroenteritis. And then I suggest you, if the child is feeding good, you can keep in the home. But when you feel the child is very sick, not accepting the oral, the child require in-hospital management and treatment. So if you feel your child activity is less and child look lethargic, you immediately take to a nearby hospital where the treatment plan differs. So I hope you would have understand about the management of acute gastroenteritis children. So rehydrate is the key to solving the issue of acute gastroenteritis. Rehydrate with WHO ORS. If you have any further doubt regarding this gastroenteritis, you can comment in the section box. We will have a detailed discussion. Until then, bye from Dr. Shashidharan.